Hi everyone, Dr. Daniel Boggs here. I'm going to talk to you on this video about leaky gut syndrome. Now, this is something that we're starting to hear more and more about, and I want to make sure that you get a clear understanding of what leaky gut syndrome is. And first of all, understand that leaky gut syndrome is a real thing backed by research. So, I want to talk about what leaky gut syndrome is, what causes it, and how it can be treated. Now, I'm going to get a little bit into physiology, but I'll try to keep it from being too confusing. So, just follow along, and I think you'll find this video helpful.
Okay, let's get started. Now, we're understanding that the root cause of many poor health issues and undesired immune reactions actually originate in the gastrointestinal tract, or the gut for short. So, the GI tract or gut, when you have abnormalities, it can compromise the integrity of the gut barrier. So, the gut barrier is going to be represented by this layer up here, which is separate from the bloodstream. We don't want to allow things to pass through the gut barrier and get into the bloodstream. Because when that happens, when you have a breakdown of this gut barrier integrity, you can have the entry of what we call undigested antigens into the submucosa and into the circulation. And this challenges or stresses the immune system. So, antigens, which are represented by these things up here, would be things like lipopolysaccharides, bacteria, viruses, food particles, that sort of thing. So, when the gut barrier is broken, and these things enter your bloodstream, your body's going to react to these antigens and activate an immune and an inflammatory response. Now, this response involves the production of pro inflammatory cytokines and different types of antibodies, both of which can cause further damage to the gut barrier, and it contributes to increased leaky gut syndrome. Now, when this gut barrier is broken, some of the things that you'll see that can happen will be food intolerances, autoimmune conditions, inflammatory diseases, and various other health problems. So, some of the conditions that have been associated with leaky gut syndrome are celiac disease, non celiac gluten sensitivity, eczema, neurological conditions, and various types of autoimmunity. And I want to talk about autoimmunity for a second because autoimmune diseases are on the rise. And autoimmune diseases are when your immune system attacks your body. So these would be things like rheumatoid arthritis, Hashimoto's disease, multiple sclerosis, psoriatic arthritis, that sort of thing. And what research is now telling us is that these conditions are caused by something called the triad of autoimmunity. Okay, so there are three things that have to be present for you to develop an autoimmune disease. The first thing is you have to have a genetic predisposition. The second thing is you have to have leaky gut syndrome. And the third thing is you have to have an exposure to some sort of an environmental trigger or an antigen. So, leaky gut syndrome is one of the things that has to be present for you to develop an autoimmune disease. So, it's very important to understand the role of your gut barrier when it comes to your health. Now, you need to know that there are various barrier systems within your body. So, you have your skin as a barrier system, your lungs, your gut barrier, your brain barrier, just to name a few. But I just want to focus on the gut barrier today. So think of your gut barrier or your gut lining like a screen door. So a screen door it keeps bugs out of your house, but it has small openings that allow air to flow in. And the gut barrier works much the same way. It keeps large particles and bacteria and things like that from crossing your gut and getting into your bloodstream, but at the same time, it allows essential nutrients to pass through and be absorbed. And this is one of the primary ways that your body is protected from invaders from the environment. So we're going to go to this illustration. And I want to show you how this works. So there are two components to your gut barrier: an intrinsic component, which separates the inside from the outside, and then it has an extrinsic component, which protects the intrinsic layer. Now, the intrinsic layer that separates the inside from the outside is made up of epithelial cells and tight junctions. So these pink boxes here represent your epithelial cells, and these little stitched looking things are the tight junctions. And the tight junctions block things from going between the epithelial cells and getting into the bloodstream. Now, when there's damage to that system, which is represented over here, you can see how if these tight junctions break down, these antigens can pass through and get into your bloodstream, and then your body will elicit that inflammatory response. So that's the first component of the gut barrier. The second component, the extrinsic component, is made up of secretions like mucus and something called secretory IgA, and this is where your healthy beneficial gut bacteria is involved. So With that being said, let's talk about what happens to the gut lining with leaky gut syndrome. Well, first, let's talk about what causes leaky gut syndrome. And it's really multiple things. So, dietary factors are a big cause. So, things like drinking alcohol, taking antacids that contain aluminum hydroxide, exposure to bacteria like E. coli, certain foods that contain lectins. So, foods that contain lectins would be things like beans, peppers, and nuts. Gliadin, which is part of gluten. Another thing are taking NSAIDs, non-steroidal anti-inflammatory drugs, oral contraceptives, and then there are just other different foods like potatoes and eggplants, your nightshade vegetables. All of these things have been shown to contribute to leaky gut syndrome. Now, some non-dietary factors that contribute to leaky gut are things like alcoholism, and not even full-blown alcoholism. Even a short-term binge of just 4 drinks has been shown to accelerate gut barrier breakdown. Stress, dysbiosis, which is an imbalance of good versus bad bacteria, thyroid problems, autoimmunity, food sensitivities, just to name a few things. So as you can see, leaky gut is from a combination of a lot of different things. It's not normally just one thing that causes it. So what happens with leaky gut is that you can get breakdowns in your barrier, like what is represented here, where antigens cross that gut barrier. And again, antigens are things like lipopolysaccharides, food proteins, viruses, bacteria, basically things that don't belong in the bloodstream. So when these antigens cross the leaky gut, they cross that barrier and get to the bloodstream again, it's important to know, I know I've said this a few times, it causes an inflammatory and immune reaction. Now, these antigens can cross the barrier in 2 different ways. They can cross transcellularly, where they actually break through the epithelial cells, or paracellularly, where the tight junctions break down and they pass through in between the cells. And we can actually test to see where these breakdowns occur, and we'll talk more about that later. But when this happens, again, these antigens get to your bloodstream. It causes this immune and inflammatory response by the body because the body's treating these things like invaders. They're not supposed to be in your bloodstream. And this can lead to a whole host of different types of health issues. And what's more, these inflammatory cytokines that mediate this inflammatory response can travel through your body, and they can cross your blood-brain barrier and start attacking your brain. And this is how we see the onset of things like anxiety, depression, and even into things like dementia, all related to your gut health. So, what are some of the signs and symptoms related to leaky gut syndrome? Well, you can see things like fatigue, malaise, which is just not feeling well overall, anxiety, insomnia, arthralgias, muscle pain, fever of unknown origin, food intolerances, stomach pain, diarrhea, skin rashes, cognitive and memory problems, shortness of breath, poor exercise tolerance, just to name a few. So obviously these symptoms can also be connected to a lot of other health conditions. So you can't just assume that you have those symptoms, that if you have those symptoms that you have leaky gut. I mean, in our society, it's pretty likely just because of our lifestyle that leaky gut is at least a contributing factor, but it's important to get tested if we suspect leaky gut. Okay, and one thing you don't want to do is oversimplify leaky gut syndrome. So what I mean by that is leaky gut syndrome isn't just from gluten sensitivity. It's not just from poor gut bacteria health. Remember, your gut bacteria is just one part of the external component of your GI barrier. There's so much more to this than just your gut bacteria. So how would you diagnose leaky gut? Well, there's a test that's been used for almost 50 years using lactulose and mannitol. And I'm not going to really go into the test because it's more than we really need to get into right now, but that's not the best test nowadays. The best test is through Cyrex Labs. It's a Cyrex Array 2. And this tests for various antibodies that are related to gut breakdown. It actually helps us to identify where the breakdowns are occurring in the gut lining. So this is the best way for us to test to see for sure if you have leaky gut syndrome. So when you have leaky gut syndrome, what can you do about it? How do you fix it? Again, it's much more complicated than just getting off gluten and dairy or just taking probiotics. All those are important steps. There's more to it. What I use in my office is I use a comprehensive 4-step process. Now, this process is all natural. No drugs are used. The first thing that we do is it's a good idea to test for food sensitivities if you can. Then you need to remove these foods that you're sensitive to from your life permanently. Now, I start patients on a strict autoimmune protocol diet. So that's the first step. The second step is to give you supplementation to repair the gut lining where the gut's been damaged. The third step is to assess for any type of gut infection. So this could be from H. pylori or some other type of antigen. So we need to kill off any infection that's present. And then the fourth step is to make sure that you have healthy digestive enzyme levels, healthy stomach acid levels, and then healthy gut bacteria function. Now, once we do that, what's the prognosis? Well, the vast majority of patients that I put through this protocol see a big difference in their health very soon. Now, with leaky gut, we can periodically monitor your progress through repeated testing of the Cyrex Array 2 lab, and by that way, we can track your improvement. Now, there are extreme cases where someone's gut is so damaged that it just really never heals. Now, that doesn't mean that you won't get any help or you won't get any better from your health condition. It's just that these people basically have to work on their gut health for the rest of their life. But it is beneficial, even in those extreme cases, to go through this gut repair program. So anyway, I hope you found this helpful. If you have any questions, just feel free to reach out to me. Or if you'd like to consult with me about my leaky gut repair program or my gut health program, just feel free to reach out to me. You can send me a private message here on Facebook, or if you're watching this on YouTube, you can email me at drdanboggs@gmail.com. That's DRDANBOGGS@gmail.com. So thanks for watching, and I hope you have a great day.